Hello EHS Sports Medicine. Today we're going to talk about anatomical terminology. And you might not be able to see all of these terms behind me, but that's okay. I attached another file with all the terms and the definitions. I'm just going to show you physically what some of these terms and movements mean throughout this video. So first we're going to talk about anatomical position. Anatomical position is the position that most of the rest of these terms are based off of. So anatomical position is standing, arms by your side, palms of your hands facing forward, just like this. And a lot of these other terms are going to be based off of a person being in this position. I kind of broke it into categories, so the rest of these terms on this side over here are all going to be based off of anatomical position, and I'll kind of talk about what that means. So the first term is anterior. So if I'm standing in anatomical position, anterior means everything in the front. So my face, my chest, my stomach, right, my kneecaps, the front of my shin, stuff like that. Now when I get to my hands, because I said in anatomical position, my hands are by my side with my palms facing forward. That means the palms of my hands are anterior. Let's say I go ahead and do this though. The palms of my hand, I know this is going to be confusing, but the palms of my hand are still anterior. Even though they're not on the front anymore because they're facing backwards, I'm not in anatomical position, right? So for example, if I said the head is the top of our body, if I went into a handstand, we would still consider the head being the top of my body, right? I wouldn't say, well, now that you're in a handstand, the head is on the bottom and your feet are on the top. My head, if somebody asked you, is the head on the top or the bottom of your body? We would always say the top. So just because somebody's in an awkward position or out of position, that doesn't mean the term changes. If that makes sense? So anterior is always everything on the front in anatomical position. If I get out of anatomical position, I need to put that person back into anatomical position before I answer that question of what is anterior. So moving on, the next term is posterior. Posterior is just opposite. In anatomical position, it's everything on the back, right? So the back of my head, my back, my hamstrings, the back of my knee, the heel of my foot, the back side of my hand, my elbow. Those are all posterior things on my body. Everything on the back side. And again, this is if the person is in anatomical position. So if they get out of position, we need to put them back in position before we answer that question of what is posterior. Medial. Imagine I'm in anatomical position and I draw a line directly through the center of my body. So through my nose, through my belly button, through my legs. Anything closer to that line is going to be considered medial. So my pinky fingers are more medial than my thumbs. This is the medial side of my knee. In anatomical position, this would be the medial side of my elbow, right? The inside of my foot is the medial side of my foot. So again, if I drew that imaginary line down the middle of my body, anything closer to that line, that midline, is going to be considered medial. Lateral is going to be just opposite. That same line that we drew, anything that's further outside from that line is going to be considered lateral. So my thumbs are considered the most lateral finger. My pinky toes are going to be considered the most lateral toe. This is the lateral side of my knee. This would be considered the lateral side of my elbow, the lateral side of my shoulder, etc., etc. So again, everything further from that midline. Superior means above. So like my head is the most superior. We can also talk about an individual body part. I could talk about my patella, for example, my kneecap. This would be the superior part of my kneecap. This would be the inferior portion of my kneecap, right? The top of my kneecap or the bottom of my kneecap. Inferior is just opposite, where it means below or lower than. So again, my feet are going to be inferior. This is going to be the inferior portion of my patella or my kneecap. Proximal. Proximal means closer to my torso. And what I mean by torso is this right here in between my neck and my waist. So this right here, basically where my shirt is, this is my torso. So when I'm talking mostly about my arms and my legs, what's more proximal, my elbow or my wrist? What's closer to my torso? My elbow, right? So my elbow is more proximal than my wrist. So my shoulder would be the most proximal, my fingers would be the most distal, my hips would be the most proximal, my toes would be the most distal, but we can also compare things. So I can say, for example, what's more proximal, my wrist or my elbow? Right? The answer would be my elbow. But I could also say what's more proximal, my elbow or my shoulder. The answer would be my shoulder. So it's anything closer to the torso. Distal, think of distance, think of farther away, and it's exactly opposite of proximal. It means further from the torso. So my fingertips are going to be the most distal, my toes are going to be the most distal, anything further is more distal. So my elbow is more distal than my shoulder, my wrist is more distal than my elbow, my fingers are more distal than my wrist. Superficial means closer to the surface. If somebody says to you that their friend is very superficial, it means they're very much about their outward appearance. And that's kind of what superficial means. Superficial means outward, closest to the surface. So my hair, my skin, my eyes, my eyelashes, things like that are going to be superficial. Deep is exactly opposite, where it's deeper into the body. Maybe my bones, my organs, my muscles, they're deeper, right? And we can compare things, right? What's more deep, my ribs or my heart, right? The answer would be my heart. So we can compare terms, but again, the deeper into the body it goes, then the term is deep. The more close to the surface it is, the more superficial it is. So these are the terms that are all based on anatomical position. The next group of terms that we're going to talk about are all movement terms. So how we move our body. The first term is flexion. Flexion just means bending or shortening of a muscle. And there's different ways that we flex everything in our body. So I'm going to go through kind of a lot of the body parts and tell you how we flex them. So if I was to flex my neck, it would be looking down like this. Flexing my shoulder is kind of a weird one, but it's actually doing this. This, like bringing my arm forward, is flexion of the shoulder. Flexion of the elbow is bending the elbow. Flexion of the wrist, bending the wrist, more of an anterior motion. Bending my fingers would be flexing my fingers. My hips or my waist, I could do this in two ways. I can do this, right, bringing my leg up, so I'm flexing my hip, or I can do just the opposite and I can bend over. That's also flexing my hip. It's the same motion, just depends on which part of your body is moving, right? I can do this, or I can do this. I can do this, or I can do this. That's both flexion of the hip. Flexion of the knee is going to be bending my knee. Ankle, we don't use the term flexion because we have a specific term for our ankle. Extension is exactly opposite of flexion. So instead of thinking of like bending something or moving it anteriorly, typically you're straightening something out or you're moving it posteriorly. So again, my neck extension would be looking up towards the ceiling. Shoulder extension would be bringing my arm backwards like this. Elbow extension would just be straightening my elbow out. Wrist extension would be going like this, like maybe I'm a waiter or waitress carrying a tray. That would be wrist extension. Finger extension would just be opening up our hand or straightening out our fingers. Hip extension is kind of what I'm in right now. I'm straight up right like this, or I can even lean back a little bit further like that. Knee extension is what my knee is right now, because this is flexion, so straightening my knee would be extension. And again, ankle doesn't have an extension or flexion because there's specific terms we're going to talk about in a minute that are just only for the ankle that mean the same things. Abduction, and that's A-B-B. Abduction or abduction means arms or legs away from the body. So think of a jumping jack. If I start a jumping jack, my arms and my legs now, or my shoulders or my hips, whatever you want to say, are now in abduction. They're away from the body. Adduction with two D's is going to be bringing those things back to the center. So I think of it as adding them back to my body. So if my arms are by my side, if my feet are next to each other, I'm in full adduction. If I bring my arms away to the side or my legs away to the side, I'm in abduction. So think of abduction and adduction as jumping jacks. Abduction, adduction, abduction, adduction. Horizontal abduction and horizontal adduction. They're very similar to ab and adduction, meaning away or towards the body, but they're going to be in this kind of a motion. Horizontal means like drawing a horizon line like this, right? So if I'm in a neutral position like this, abduction meant away. So this would be horizontal abduction, and then this would be horizontal add. I'm adding it back. So horizontal abduction, horizontal adduction. Internal and external rotation. These are going to be terms that are specific to our shoulders and hips. So I'm going to show you shoulders first. If this is a neutral position, external means like out. So this is external rotation, where I'm rotating my shoulder outward. This would be internal rotation, bringing my arms back into my body. I could also do it in an abducted position. So meaning, think of like throwing something, right? If I'm a baseball player, softball player, water polo player, something like that, pointing it straight is neutral. This would be external rotation, like getting ready to throw a ball. And then internal rotation would be me finishing that throw, right? So if I'm getting ready to throw a pitch, external rotation, internal rotation. External, internal. Or I can do external, internal. As far as hips go, pointing your feet outward is going to be external rotation of the hips, and then pointing your toes towards each other is going to be internal rotation of the hips. Because I'm actually moving my hip joint to do this. External rotation, internal rotation. External, internal. External, internal. Retraction is a shoulder movement. So retraction is bringing your shoulders back. So if you ever get your mom or dad to say, like, sit up straight, bring your shoulders back, you know, or your physical therapist or something. So bringing my shoulders back is retraction. Protraction is reaching my shoulders forward, or like rounding my shoulders, right? If I'm sitting on a computer and my shoulders are rounded forward or rolled forward, that's protraction. And then retraction would be more of a proper stance, right? A proper movement. So retraction, bringing my shoulders back. Protraction, bringing them forward. We're going to move over here to these terms. Shoulder elevation. Think of like an elevator that brings us up. Elevate means to bring up. So shoulder elevation is bringing our shoulders up. Kind of like saying like, I don't know. So elevate, bring your shoulders up. Shoulder elevation. Shoulder depression, right? If we're depressed, if we're in a depressed state, if somebody is in depression, then they're usually low or down. So think of shoulder depression as my shoulders come back down. Neck rotation kind of sounds like what it is. It's like a circular motion of the neck, or we can actually do like this, looking side to side. So I can look left or look right. That would be rotating my neck, left or right. Dorsiflexion and plantar flexion. A minute ago when we talked about flexion and extension, I said there were specific terms for the ankles. These are them. Dorsiflexion means bringing my ankle or foot toe up. Plantar flexion means pointing my toe down. I like to remember it as point it towards the plants. Plantar flexion is point your toe towards the plants or the ground. Dorsiflexion is going to be bring your toe and point it up towards the ceiling. So kind of like a flexion and extension of the ankle, but we don't use the words flexion or extension for ankle. We use dorsiflexion or plantar flexion. So if I told somebody, put yourself in dorsiflexion, they know bring your foot up like that. Inversion and eversion. These are kind of like rolling our ankle, right? Spraining our ankle. So if my foot's like this, inversion is when the bottom of my feet are facing each other. So this is inversion. Eversion is when the bottom of my feet are facing away from each other. So this is an eversion ankle sprain. This would be an inversion ankle sprain. So eversion, bottom of your foot facing out. Inversion, bottom of your foot facing in. Supination and pronation is a kind of a forearm, elbow, kind of wrist movement. So this is supination. I like to think of it as putting my hands together and making like a soup bowl. That's supination. So it's basically rotating your palms up like this rotational movement, supination, and then pronation is palms down, right? Supination, soup bowl, Pronation, palms down. Empty out your soup, dump it out. Radial and ulnar deviation. You're gonna learn in our next video about skeletal system what the radius and ulna are. They're two bones in our forearm right here. Our radius is on our thumb side and our ulna is on our pinky side. So if I had my hand like this and I was gonna do radial and ulnar deviation, it just means kind of like a wave. So if I'm waving to you like this, hey guys, radial is when I move my hand towards my thumb. Ulnar is when I move my hand towards my pinky. So when I go thumb side, that's radial deviation. Pinky side, that's ulnar deviation. Put them together and you kind of get a sideways wave. Radial, ulnar. Radial, thumb side, ulnar, pinky side. Supine and prone. I don't have a table right here in front of me, but supine would be laying down, face up. So like laying on my back, face up. Prone would mean laying down on a table, face down. Now these are terms that we could use when we're evaluating somebody, right? Somebody has an injury, we want to evaluate their knee or their hamstring or their quad or something like that. We could tell them to lay supine or lay down prone on a table depending on if I want to see this part of their knee or if I need them to flip over to see the back of their knee or something like that. So again, supine, laying face up, prone, laying face down. Circumduction, think of like a circle. I can do this for my shoulder, I can do this for my hips, I can do this with my fingers, but circumduction just means like circular motion. So this is circumduction, this could be circumduction, right? This can be circumduction, right? Like egg beating in the water could be circumduction. So circumduction is like a circular motion of my shoulders or my hips or even my fingers possibly. These last couple terms are kind of on their own because they're not really movement terms or anatomical position terms, but I want you guys to know these ones. A sprain with a P. Sprain is gonna be an injury to a ligament, okay? An injury to a ligament. I'm gonna jump down a second, but what is a ligament? A ligament connects two bones together. So it connects bone to bone. So like over here on my skeleton, I'm gonna have ligaments in all of my joints because this is a bone, right? So we usually have where two bones meet is where our body bends. So I'm gonna have ligaments typically in my fingers, in my wrist, in my elbow, in my shoulders, hips, knees, ankles. So typically when you hurt a joint, for the most part, you're gonna have a sprain. Because a sprain is an injury to a ligament, and a ligament connects two bones together. A strain with a T is an injury to an injury to a tendon or a muscle. So typically we're gonna have those in the middle of joints. It's like my quads, my hamstrings, maybe my calf, my bicep, my tricep, my back, my abs, something like that. That's a strain. So a strain is an injury to a tendon or a muscle. What is a tendon? A tendon connects muscle into your bone. So right, I have this big quad muscle right here in the front of my thigh. This muscle connects down here at my knee and connects up here at my hip. So tendons are at joints, just like ligaments, but the muscle is in between the joints, right? This whole thing right here in between my knee and my hips is my muscle. So again, a sprain is an injury to a ligament. Ligaments connect two bones together. And a strain is an injury to a tendon, and a tendon connects a muscle to a bone. These last two terms, HIPAA and FERPA, they're acronyms. Those aren't the actual word. They stand for something. I don't need you to know that right now. HIPAA is basically athlete or patient confidentiality. So all that means is when you go see your doctor, when you go see your physical therapist, if you go see me, the athletic trainer at the high school, if you're playing sports, if something happens to you and you're hurt and you give us personal information, we cannot share that information out with other people. That's your personal medical information, and I cannot share that without your permission. So HIPAA, when it relates to this sports medicine class, means that we have to be confidential when athletes on our campus tell us personal information or we witness or see or help them with specific injuries, right? Those injuries or those illnesses or whatever they have are their personal information, and even though they're sharing them with us to help them, that's still confidential to them, so we have to respect their privacy and not post it on social media and tell everybody in the school that so-and-so got hurt or so-and-so has this or whatever the case may be. So that's what HIPAA means, patient confidentiality. FERPA, on the other hand, is still confidentiality, but it mostly refers to like you guys as students. If you've ever had a teacher that posts grades on the wall with like a piece of paper that has like their grade, but it has your ID number and not your name, that's an example of FERPA. Because FERPA is like your confidentiality for your grades, for your personal information, as far as your address or things like that, right? Me as your teacher, I have access in Infinite Campus to your address. I'm not just allowed to tell everybody else in the class what your address is. I'm also not allowed to tell everybody else in the class what your grade is or what you got on the last test or things like that. Your student grade, personal information is confidential to you, and even though I know that information as your teacher, I have to keep it private to you and me or your parents or administration or something as well, right? I can talk to other teachers, I can talk to your parents, I can talk to administration. Just like with HIPAA, two doctors can talk to each other, or your doctor can talk to your physical therapist, or your doctor might be able to send a note to our school nurse, right? Because they're within the same group of people that are still trying to help you, but you can't tell anybody outside of that circle. So again, HIPAA is patient confidentiality. Typically, as far as injuries and illnesses go, FERPA is confidentiality as far as student, school, private information goes. Hopefully you guys learned a little bit out of this. You took notes, and I want you to go back and review these and also look at my sheet that I have posted on my Canvas page that has all of these words on it and these terms on it with their definitions. All right?